All right, we are recording, and again, welcome to North Key Community Care's virtual hiring event. I am going to start off with a video, and bear with me while I start sharing that. Hi, my name is Rob Vonks, and I am the Chief of Operations and Talent Management for North Key Community Care. North Key is a community mental health center with multiple office locations in northern Kentucky, and we have been providing quality and effective mental health, substance use, and developmental disability services for over 50 years. If you're looking for a place to work where each and every day you can make a difference in the lives of individuals, families, in your community, then North Key is the place for you. At North Key, we have many different career opportunities that will allow you to not only grow as a professional, but also have a sense of making an impact in the lives of children, adults, parents, and families within our community.
Working for North Key means, actually, I've come to find that it actually means a lot, more than I had expected it to mean. I have a lot more experience than other therapists, just because of the wide variety of things that I come across, and so it's really, in some ways, an honor to have these experiences and to share them with other therapists as well.
From mental health counselors, social workers, and therapists, to case managers and care coordinators, to psychiatrists and nurses, including LPNs and RNs, to customer support representatives and billing specialists, to administrative and management roles, North Key employs staff with a wide variety of education, experience, and licensure, and with many convenient locations in Covington, Florence, Newport, Williamstown, Carrollton, Falmouth, Owenton, and Warsaw, Kentucky, North Key is able to offer a wide array of mental health, substance use, and developmental disability services that are unparalleled in northern Kentucky. For all of our positions at North Key, we offer competitive wages, and for full-time staff, we offer generous benefits, including generous paid time off package, 9 paid holidays, multiple health insurance options, 401k with employer matching, dental and vision insurance, short-term disability and life insurance, free visits at all of our primary care clinics, and a variety of other benefits and perks. We also encourage and host professional development opportunity for staff so that they can continue to grow professionally in their career at North Key. Check out our employment opportunities page on our website at www.northkey.org. And if you are passionate about making a difference in your community, then come join our team at North Key to help us transform lives and communities through excellent service. Thank you. All right, now Kennedy is going to share her screen again, and we'll come back to the PowerPoint.
All right, that's where I think I take it from here. Again, I'm Sandra. My role here at North Key is Chief of Services and Development, and I've worked here at North Key for almost 18 years. So it's a pleasure to kind of these next few slides just give an overview of who we are as an organization and an overview of some of the services that we do provide to our community here in Northern Kentucky. So as you heard in our video presentation, actually from Rob on the video, our mission here at North Key, transforming lives and communities through excellence in mental health, substance use, as well as developmental disability services. So the next slides will kind of go into some more detail about some of those specific areas. as a whole, here is the map of the state of Kentucky. So just to give a little bit of background about North Key. So we are a community mental health center, and the entire state there in the picture is all of the counties in the state are divided into 15 different regions, and each region has a designated community mental health center that is really set up to ensure there are services for behavioral health, as well as supports for people with intellectual and developmental disabilities. So you can see we are up there at the top, Northern Kentucky, and we provide services in those 8 Northern Kentucky counties that are also highlighted down there in the lower part of the slide presentation. A little fun fact we always like to throw out there is we put community mental health centers and our healthcare system into perspective in the world today. North Key is actually the longest, oldest continuously operated community mental health center in the whole country. So President Kennedy signed the Community Mental Health Center Act federally to set up this safety net across the country. It was actually one of the last acts that he signed before he was killed. So he signed it. Kentucky was one of the first states to take action on that federal act. And so, so Kentucky started to set up their safety net system of community mental health centers. There was one other community mental health center that actually started their board right before North Key, but that particular board actually went for a while, disbanded, and restarted. So that's why we like to claim that we are the oldest, longest, continuously operated community mental health center. So, overview, when we say behavioral health, we are actually referring to both mental health and substance use services. So often we know that those are co-occurring and that one can often lead into another. So we use that more general term of behavioral health. And truly, we serve all ages. So, from our youngest kiddos, we have early childhood therapists that work with families with young kiddos, as well as childcare centers and preschools, as well as those kiddos at ages 3-4 years old, and then all the way up, obviously, through adults. But focusing in here on other children and adolescent specific services, we do have therapists that work in every one of those 8 Northern Kentucky counties. So we have an office location in each of those counties that have therapists available to meet with families and meet with children and adolescents. Another big focus of our services is that yes, you can come to an office, but we also want to be out and about in the community. We want to be where families are, where kiddos are, because that takes out some of those barriers that come with transportation, getting to appointments. So school-based therapy in particular is one location that I think we're in over 90 different schools in our Northern Kentucky area, where we have a therapist that is on site in that school, elementary, middle, high school. So not only do we get to meet with the children, the adolescents while they're there, they don't have to leave school to go to an appointment. We also have the benefit of talking with the school staff, helping to collaborate with them a lot of times about behavioral issues that they might be seeing. So we end up being good consultants for school staff as well. You'll see it lists care coordination. So you may have also, people refer to it as a case manager or case management. We like to use the terminology care coordination because that's truly the essence. That is what they are doing, is that our care coordinators work to connect all of the different, maybe it's other medical providers, therapists, school staff, family members, church communities, whoever can be that network of support for an individual, for a family. We have psychiatric services. So we have psychiatric MDs and APRNs, which are advanced nurses who can prescribe psychiatric medication for children and adolescents who have are dealing with symptoms of their mental illness that are just so severe that there is medication that can help with those symptoms. Family peer support. So a peer support is someone who has experienced whether it's mental illness or substance use themselves, and that they are at a place in their recovery where they can share with others what that journey has been like for them. A peer support really has a unique role in that they do get to share their own personal stories. They do get to say to someone, I know exactly how you feel, because they may have been in a very similar situation. So the family peer support for children and for families is actually a parent or a caregiver who has a child that they supported dealing with mental illness or substance use. They have experience navigating the system of behavioral health services. So this is a really awesome opportunity we have to support our families with a family peer support who can just be another person in their life to help support and guide them through the challenges that come. And then youth groups, and I'll talk about it quickly in a few slides, but our prevention center staff works with schools in the region to support a lot of their activities and youth groups that are involved as well. And some of those youth groups focus on reducing stigma of mental illness, reducing suicides in their schools. So we're able to support them in those efforts as well. So that's a little overview of some of our support system and staff that we do have here at North Key. I think the next slide, some of these I won't repeat because they're duplicative, but focused on adults then. So that was primarily our focusing like school-based services up through adolescence. And then of course, all of the adults up to however long you can make it in this world, we want to be walking alongside and supporting people, their families. So most of these I talked about: outpatient therapy, care coordination, psychiatric services. For adults, we actually also have primary care services available. So for quite a while here at North Key, we have been very focused on what we call integrated care, where we know if you are not doing so well behaviorally, mentally, often your physical health takes a toll, might not be doing so great. And if you're not feeling well or you're dealing with illness, chronic illness physically, that has a direct correlation into how you are doing mentally as well. So we have primary care prescribers at 3 of our office locations in Covington, Florence, and then in one of our rural counties in Carroll County. And so our clients can really have a one-stop shop that they can come to, if you use that terminology, where we are all working together as a treatment team to support that individual. And so they can have a psychiatrist, and they can have their primary care physician, and they can have their therapist and peer support all at the same place. And that's so beneficial in so many ways. We're, again, all working together as a team to step in and provide the supports that are needed. For adults, in addition, we do have peer support, supported employment, where if someone is dealing with mental illness or substance use and would like that additional support to find a job, interview for a job, even once you have a job, keeping that job, when people are dealing with symptoms of mental illness, there's ups and downs that come with recovery. So we're able to step in and work with employers as well to support them in keeping full-time or part-time employment. I could talk on and on. I think I'm supposed to give an overview of these slides, but I will try to keep Madeline and everyone else, Amanda and Samantha, thanks for keeping on with me. I'll just keep going, but overview. TR, this is a support, a group, an everyday group that we have for adults with mental illness, as well as assertive community treatment. That's a more intensive wraparound support we're able to provide individuals. supported housing. We all know housing is very challenging, finding housing, keeping housing. So we do provide staff who can walk alongside individuals and families to help them navigate the current system and environment that is out there. Substance use and IOP groups as well. So as I've referenced, substance use services and individuals with substance use disorders. There are all different levels of care. Our highest level of care is that we do provide every day, 3+ hours a day support for individuals who are at that higher level of need. In addition, you can see there's some different specialized groups that we offer as well. Sober parenting group and LGBTQ+ group therapy. So we're always adding to that list as well, as we have individuals that have unique needs, and we can try to step into that space to provide the supports that are needed. And then the quick overview on our services for individuals with intellectual and developmental disabilities. We provide that care coordination, case management. In addition, we have adult foster care providers who have individuals with intellectual and developmental disabilities living with them. When we say foster care, we often think of kiddos and their families, but this is a whole network of support for adults with developmental disabilities that we're able to have live in the community with families, which is pretty amazing. And then you can see listed some of the other supports that we have. We do have our adult day training programs in 3 of our rural counties, where that's an everyday kind of activity center where individuals can come and be on site for both social support as well as working in our greenhouses that are set up for that adult day training program. And then one of the kind of hallmark, kind of foundational things about the Community Mental Health Center structure and network within Kentucky is that there are 24/7 crisis services. And so we always have a therapist available to take calls for people who feel like they are in crisis. And then our therapist can talk with them and help them just navigate and figure out what are the best next steps. And if we need to meet with them right away to help support them or help figure out, like maybe they do need to go to the hospital for a higher level of care, we have staff available to help out with that. And then this, I think this is my last slide, is I mentioned earlier when it was the youth groups about our prevention center staff. So that's another key part of our services here in Northern Kentucky, is that we have prevention specialists who are available and out and about working with different community groups to provide kind of consultation, technical assistance in ways that we can get information out and prevent substance use, prevent suicide. This is an all hands on, everyone in the community, like, let's work together on this. And so our prevention center staff are a key component to making those links and those connections. So again, I could talk for a long time about each of those slides, but that's the general overview. I think next, Jennifer Miller, who's our lead manager of behavioral health services, specifically, I think there's 2 different positions that we wanted to highlight in this hiring event today, that she can share more of the sort of day-to-day details of what those positions look like.
All right, thank you, Sandra. As she said, my name is Jennifer, and I do want to talk a little bit today specifically about our therapist role and what it is that we're really looking for with our therapists, as well as talking through what it is that they do on their day-to-day work schedule. So we do provide different types of therapy. We do individual. Sandra talked a lot about the groups that we offer. We also do family therapy, couples or marital therapy. So we're really geared at meeting whatever need it is that our clients bring in. And so our therapists do work at several different locations. We do have our outpatient offices, and we are seeing people from 2 to forever. As long as they want to keep coming, we are here to keep seeing them, of course, given their clinical needs to do so. We also have our virtual opportunities to provide therapy. One of the few good things to come out of the pandemic has been the ability to get our Zoom access up and going, to really be able to reach our clients wherever it is that they are. That does help cut down on a lot of barriers that they may face with transportation, with time management. You know, if they only get a 30-minute lunch break, we want to be able to see them during those times. And so the virtual option, we do a lot of virtual from our offices. Sometimes our therapists will do virtual from schools, wherever the need is, but we do provide services in all of those different ways. One of the greatest things that you heard in that video that Rob played earlier, you heard Kelly Smith, who's one of our therapists, say that he gets to see a lot, and he's found that he's more prepared than a lot of therapists from elsewhere. And that is because of the amount of folks that we see and the different opportunities that we get with our therapists. So they see folks who are SMI, which is severe mental illness. So those folks who have things like schizophrenia and major depressive disorder that, you know, are long-term needs that they have to manage. Our SED is for our emotionally disturbed students, our kiddos, who are being impacted at home, in the community, in their schools, and who are struggling to function effectively in those places. And so our therapists work with those kiddos very hands-on to help them determine what behavior changes can they implement, what do they need to process from their trauma, all of those things to help them be more successful. SUD is substance use disorder, and wanting to make sure that we are providing as much care as we can for those folks. We have quick access teams, so some of our therapists do excuse me, immediate response for folks who are calling in with substance use concerns, and doing quick evaluations to get them connected to the appropriate levels of care. One thing that we know is that very few folks exist in only one of these categories. There's a lot of co-occurring disorders that we see, and we deal with folks who are having a lot of different areas of struggle. PTSD is a very common issue that we experience, and even those who don't necessarily have full criteria for a PTSD diagnosis, a lot of trauma that we're working on with folks. As I already said, it's all ages, it's lifespan. And so we get to have that opportunity to serve all of these folks. Anyone and everyone that needs help in our community can come to North Key, and our therapists will work with them. One of the pieces that we want to do within our therapy sessions on a day-to-day basis is collaborative documentation. If you're not familiar with that term, what that means is that we like to do our notes with our clients. We want to have them involved and engaged in the process of recording their notes, talking about what did we do in session today, making sure that we're all on the same page with the treatment plan and the understanding of what it is that we just worked on today. And so we really want to incorporate the client and their voice into that process as much as possible. It also helps us get our notes done quickly, so that if somebody does call in that night to our crisis line, for example, we have a quick way to see what's happened today, what do we need to work on, what did their therapist talk with them about earlier in the day. Another really key component of our therapists is the person-centered recovery plans, which is just a specific way of doing treatment planning that, again, focuses very heavily on the client's voice. We want to hear from them. What are their goals? We want to know exactly where they want to focus their treatment. It is not our plan, it is theirs. And so we are very much focused on engaging our clients. That's a big part of what we do as therapists all day, every day, is talking with our folks, hearing what it is that they want and need, and then helping them develop very set plans on how they're going to get there. And then we support them through that. In order to be a therapist, there are a few specific qualifications that we are looking for. You do have to have a master's degree in an appropriate field, which could be social work, counseling, marriage and family therapy, psychology. You basically just have to be able to get a license in the state of Kentucky. As you see on that second point, it says license eligible, so you don't have to necessarily have it already, but you do need to be eligible to get that license, and we'll work with you through that process to help you get licensed so that you're eligible to provide therapy. All of our therapists that are with a dependent license, meaning they require clinical supervision, do get that clinical supervision provided through Northkey. And so they meet with their supervisor at least once every week to make sure that they are processing through the cases that they're dealing with, the diagnoses that they're working with, making sure that they know how to operate most successfully and get the support that they need. So that is something that's very important. We want to make sure that everybody feels that they are competent in what they're doing. We have very busy offices. As a community mental health center, that means that we don't turn people away, which means our therapists are constantly working. And so we want to make sure that they have as much support around them as possible. So those are the pieces about the therapist in particular. And I know we're going to talk more about our access specialist role next.
Thanks, Jennifer. Thanks, Sandra. Next, I'm going to play a short video about our behavioral health access specialist position.
My name is Liz Bullock, and I supervise the Behavioral Health Access Specialists. Northkey is a nonprofit community mental health organization, and because of that, we are the state provider for a lot of services, and we do not turn people away. Because of that, we have lots of people coming in at all times. That was a big motivator for this position, kind of having people who could be the face of Northkey when clients first come in, and they can take the main caseload of the intake and then transfer them to their ongoing therapist.
Hello, my name is Ashley, and I am a behavioral health access specialist. We complete the first 2 intake appointments. We assess for trauma, substance abuse, any depression, anxiety. From there, we will also refer for services, whether they need access to case management, assistance with housing, employment, medication services, primary care services. We are kind of the first stop for the client before going into their ongoing therapy or their IOP program.
The main qualifications are just that the person is working towards a master's degree.
My name is Sarah Goodman. I am a behavioral health access specialist here at Northkey. One of the requirements for this position is to be in grad school. It's a lot of work, but I have been enjoying it so far. I'm very close to graduating, and it's new every day. You don't see the same type of symptoms each day. I enjoy it. I've always wanted to help people, so this just gives me that closer step to that.
The main positives of this job is that you get direct experience working with clients, which is often really hard to do in our field because typically you need to have that master's degree in order to actually work with people, but this allows that to kind of happen as you're getting a degree. The current access specialists really get a lot out of the position towards their schoolwork, and then they can apply their schoolwork towards their job too.
Kind of juggling work and school has made school a little bit easier for me because I am getting the hands-on experience and I'm able to apply the things that I'm learning in school in real life. It is very immersive, and you get a first-hand look at a wide variety of diagnosis.
All right, thank you. So as I mentioned in the video, my name is Liz Bullock, and I supervise the Access Specialist team. Excuse me. So some of the main points about the position, kind of the main thing that you do is complete the initial screenings. So you are that first face for the clients as they come in the door. And So part of it is welcoming these people, making them feel safe, but then also completing these screenings. We do have an electronic health record system with the screenings in them. So really the notes and the questions that you need are there for you. And we do a lot of training in the beginning to learn how to use that system and those screeners. And then another piece of that is formulating a diagnosis. So we give a lot of support for our access specialists. We have individual supervision and group supervision, and I have people call me all the time at random times just to staff a case to formulate a diagnosis. So you're never alone with that piece. And then the second visit is a biopsychosocial assessment. So there's a lot of experience in doing just a full rounded assessment. And again, those questions are in our record. And so that collaborative documentation piece really comes in, where you kind of have what you need to ask while you're with the client. And then the next piece is referring to the appropriate level of care after those first 2 sessions with the client. So as Sandra went over all of the many things that we have in-house at Northkey, which is really awesome how much we can offer as an organization. And the access specialists really get to kind of give those to the clients and be that first referral source. So the clients do get scheduled with their ongoing therapist after the first 2 visits. And then there are also multiple other areas of support that they can be referred to as well. And then as mentioned, sort of in the video, is the access specialist qualifications. So first is a bachelor's degree in a human services field like social work, sociology, psychology. There's a little bit more to that list. It doesn't have to be those 3 specific. And then that you are currently enrolled in a master's degree program that also will lead to a license. So things like counseling, social work, marriage and family therapy, psychology. So as you heard in the video, that is a big piece. You know, you're a student while you're working here, and we really work with you. And I really, honestly, the access specialists currently tell me all the time that they just told me this morning that they feel like they are so ahead of everyone else in their program because they see these things on a daily basis. So they really get a lot out of it. And then here's some things to expect. So first, it's a very independent position. So you are placed in an outpatient office, and you are pretty much in charge of your schedule. You will have some clients scheduled for you, and then you will do some of the scheduling as well. So it takes a lot of organization and being good with things like that. I, as the supervisor, am not with you, next to you all day long. So definitely need to be good at kind of figuring those things out independently as well. And then next is flexibility of work hours. So we do typically have the work day of 8:30 to 5 o'clock, Monday through Friday. And there is some flexibility to that. Like I said, we're hiring you knowing that you are a student or going to be a student in a master's program. And so sometimes you will have class at 3 o'clock in the afternoon. And we do have somebody right now who has that. And we have been able to just kind of flex her schedule around so that her work hours are not the typical 8:30 to 5, but she still gets those 40 hours in every week. So we can work with people like that. Also, as I mentioned, we are very, very passionate about giving you the support that you need. So we have weekly supervision with an individual supervisor. And then we also have a group supervision where all of the access specialists meet once a week for an hour to kind of support each other and staff cases if needed, and just that weekly check-in. A lot of this will probably be new to you in this field. And we do work with a lot of clients who come in with sometimes sad stories and sometimes really heavy things. And so this is almost like a support hour as well, sometimes when we need it. So we are constantly offering that. And then again, as mentioned so many times, this is a great opportunity to experience diverse population and get that practice with diagnosing that you just don't really get in school alone. So it is a very fast-paced environment. You typically will have clients scheduled all throughout the day, and it could be a child 1 hour, an adult another, and very differing presenting problems and things like that. Another thing that we offer for all of North Key is in-house training. So we have at least one training a month, and then there are constantly other outside resources that we're offering as well. So that's a quick overview of what to expect for the access specialist position.
Perfect. Thanks so much, Liz. Well, that wraps up the presentation portion, and we come to the question and answer portion. So if anybody has a question, we would love to hear you. You can unmute yourself or put it in the chat box. But Amanda, Madeline, Samantha, any questions? Well, if you have questions sometime later, feel free to reach out to us, visit our website, and contact us. Kennedy, if you want to go to the next slide, please. This is a link to our employment opportunities page on our website. And from there, you can see a list of all of the positions that are available right now, but we are certainly recruiting for mental health therapists and also behavioral health access specialists. If you are interested, I mentioned earlier when we started that we are having virtual interviews later this afternoon. Are any of you participating in that, or would like to? If you would like to participate in that and you're not currently scheduled, if you want to maybe put something in the chat box, you can send that directly to me in the chat box, and put your contact information in there. We can reach out to you right away and schedule something for later this afternoon. Or if you're not available later this afternoon, we can reach out to you and schedule something for a later date. But any questions or comments before we wrap up? All right. Well, Madeline, Samantha, Amanda. I see Amanda, you have an interview at 1 o'clock. Perfect. I think that'll be with Jennifer. So Jennifer will get to know you there. And if Samantha or Madeline, if you want to schedule an interview, feel free to reach out to us. But again, thank you all for joining us here today. Thank you to Sandra, Jennifer, Liz, and Kennedy for putting this together and your expertise today. And we look forward to hearing from you sometime in the future. Thank you all and have a great day.
Thank you.
Bye-bye.